My name is Kefaladelis. I'm the lead dentist at Forum Dentistry, St. Leonard's.
My name's Henry. I'm currently a lead dentist at Forum Dentistry. I chose to partner with National Dental Care probably because we share the same vision as to where we want the practice to be going forward, and also we share the same, values and beliefs, in particular to patient care.
For me, it was a situation where I wanted to start enjoying the dental practice I've built up over the years and enjoy treating my patients comfortably, quietly, with no stress, and knowing that I've got a strong team behind me that has my back and evolves with a changing environment that we're all working in. We made it clear what we wanted to do and what our concerns were even at the very early stages of negotiating. We were reassured nothing was going to change, and 3 years in, nothing has changed. And we do have full autonomy.
My worries centered mainly about my day-to-day activities, how that would change it, stability for the staff, how that would affect my clinical autonomy. How will I be able to see my patients, and ultimately how that would affect them as well. Having worked with NDC for the last 3 years, my worries were all for nothing, really. If anything, NDC's been supportive and they've made the transition quite easily and seamless. It's one of the good points about NDC. They do respect our clinical autonomy. They understand that we are unique, we're all different. They want to get to know us as clinicians and our patient base as well.
We have well-trained practice managers that are sourced within the network, that are trained in the network, that have got good support groups, they're in touch with each other. As the network expands, we don't get forgotten as the old kid and the new kid gets all the attention. It's that everybody feels relevant within the network. Their investment, their equipment, their support, they do source the best of everything. The best thing that I've noticed that we've done in improving is our IT, our computer systems, our x-ray systems, our workflows. And for us, that is something that's very reassuring, so that we know that whatever gets done, it gets done right. The value that we've gained is probably the biggest one, is confidence going into the future. For us, it's a situation, and in my case at least, is I still see my career ahead of me, but at least I know that I've got a team that I'm navigating through. And all the things that if I was on my own would absolutely bog me down in work and take my mind away from my patients, which I think at the end of the day, they are the most important aspect of our practice.
What it's changed is it's allowed me to focus on the clinical aspect. I never really loved running a practice. It's just part of it. And so having partnered up with NDC, they look after everything from marketing to payroll to our suppliers. That frees up a lot of things in the back of my mind. Even after work, I still have to think about the practice. And now I don't. It frees up a lot of bandwidth and allows me to concentrate on just what I love to do best, which is just working with patients. For them to look at the whole situation as a whole and see if it's right for them. And I know it'll be a little bit scary, there's some anxiety involved, but if it's right for them, they wouldn't regret it. I haven't.
Every practice is unique and every single person is unique, and everybody's reason for selling is unique. There's different aspects of when you're going to sell or why you're selling. For me, it's if you want a long-term partner, somebody that will be next to you for many years, NDC is the best network or corporate to join. They're as committed to the long-term as you would be. That's probably the best advice I could give people, that it'll probably see you through into your profession, and you can enjoy your life a little bit more.